actually not totally or completely loss of vision, but it is to see much less than normal people.
Blindness is strictly defined as the state of being totally sightless in both eyes. A completely blind individual is unable to see at all.
Why we are getting blind people? So some blind people will be like that since birth, so they have congenital reasons. They got infection during their intrauterine life, they got infection or disease while just born, or they got something acquired during their developmental age, or they got it even after they have full development and growth as adults. So what are those causes? One of the causes, of course, is infectious, which we can call it a preventable causes of blindness. Other causes are not preventable, like for example tumors, like we have also diseases which cannot be prevented, and like autoimmune diseases, which is the body are attacking their own tissues. And also we have cataracts, we have increased intraocular pressure, which is called glaucomas, which we don't know exactly the reason of its existence.
Vision problems can develop before a baby is born. Sometimes, parts of the eyes don't form the way they should.
We can still make some sort of classification for blindness in kids, because some of these cases are preventable and others are not. So how can we know, or how can we know that this is a preventable cause of blindness? Of course, as any type of medicine, the infection is definitely preventable. So we are reaching those types of infection which we call them TORCH. TORCH means an abbreviation, stands for toxoplasma, cytomegalovirus, different types, herpes, different germ measles. Those infections could happen to the mother during the time of pregnancy, are definitely can be prevented from the start, and at that time we definitely will get a healthy eyes for our kids. Definitely we have to be aware of animals, many of the animals which may carry toxoplasmosis. You know, toxoplasmosis is the disease of cats, so it can be carried by cats or dogs. So those who hold them at home, they have pets, they have to screen them well, they have to be cleared from these infections. Definitely sexually transmitted diseases during pregnancy, they may really be infected towards the mother and from the mother to the kid during labor or during pregnancy, and these diseases are preventable. We have some statistics regarding different causes of blindness. Definitely the poorer the area, the more blindness among infants we have, and definitely the areas which is having or receiving less medical care and antenatal care, they have more incidence of blindness among kids. There is no real difference between males and females for the blindness among kids. There is no difference real, but again, the care which some people will give for their boys maybe sometimes more. So we are seeing more complications among girls, but actually the diseases are most of the diseases are 50-50. Definitely it is so difficult to treat congenital blindness, much more than acquired ones or acquired causes for blindness. We are really suffering from treating those causes of blindness whom started early in childhood, or the kid will be born with it. It is resistible, irreversible, and really very tough to deal with. A word so much medical, but we are talking about that when one problem occurs in one area of the body, it may be associated with other problems in the body. So blindness is not alone sometimes, unfortunately, yes. It may accompany deafness. So sometimes we will find kids who are also mute, deaf, and cannot talk, cannot hear, and also cannot see. And some infections can cause those together. Also, mental retardation is sometimes, for many reasons, can accompany blindness.
A kid's eyes might look fine, but the brain has trouble processing the information they send.
So a very famous question is asked: do the eye see or the brain see? If it is the eye, so how the eye can see? Actually, the eye is the camera which is capturing the image, which is going to the brain to be interpreted. This is how actually simply we are seeing. The image is captured from the camera, which is the eye, and you have to have a clear visual access to capture this camera, to capture this image. Meaning you have to have a clear cornea, clear lens, healthy retina. So every part of the eye has to be healthy, transparent, which is supposed to be the parts of the visual axis has to be transparent. And if we can get a good image at the end to be on the retina, which is the last part in the eye receiving the image, this image will be sent through the optic nerve. So the optic nerve is like a wire transferring this image to reach the cortex. The cortex is the part in the back of our brain, which this area is the area for the vision. So it will be received in a complicated pathway to reach this area. So you will interpret the image and to be understood by the brain. This is simply how can we see. So definitely we can simply say that the brain is the one receiving the data from the eye, but the image has to be captured by the eye itself.